So would you permit us to get this interview on internet and put it for educational purposes on internet for other people, including other professionals and other patients?
All right.
I really don't care. I don't know. To me, he's the best.
Could you explain to me your symptoms before the surgery, specifically your pain in the back as well as the leg? If you would describe it to me with the pain intensity from 1 to 10, as well as how long you had the symptoms.
Tanner and I are extreme pain.
And then,
I had a numbness. I was getting pain down my leg, and it was because the can't even think of it now. Sciatic nerves were being pinched.
I understand you live in Wisconsin. Could you tell us, your experience about who you saw for your primary care for your spine, what your experience was there, and then when we met, and as well as where we met?
Because Green Bay is they've got a better hospital system, larger, and that's Green Bay, Wisconsin.
mm-hmm.
And they said no, scoliosis, don't even bother coming up. And then Marquette, there was a doctor, but I couldn't get into him. He dealt with scoliosis, but he suggested Ann Arbor, Minneapolis. What is it? Spine and Brain Center, or Brain and Spine Center Institute, or whatever it is, to see a Dr. Mulaney. And I was totally disgusted with him. He told me I was more or less, there's nothing he could do for me, more or less is what he told me. And I thought, there's no way. And my wife was online, just accidentally found Dr. Abbasi, who specialized in scoliosis. And I said, well, I said, I don't want to go bother, you probably won't be able to do nothing for me anyway. And she says, well, should we give it one shot? I said, yeah, let's give it a shot. And when he told, that's why I'm here. I mean, we came and seen him, and he looked at me and he says, I can fix it. He says, did lots of patients older than me. He says, they're fine, so.
Tell me, we had this meeting in Twin City area, I believe, and we talked about your problem, which is a very severe scoliosis. And we looked at the films together, and we noticed that practically your spine is side bending significantly, putting more stress on your spine. And we talked about options which are a big surgery, scoliosis surgery, which we would go literally open you from all the way from neck down to the tailbone and put the spine in a certain way together, or we do a smaller surgery since your symptoms were so focalized, mostly in the lowest segment where it was pushing on the nerve. Could you tell me our conversation about what you remember about that conversation and what we decided to do?
That's where the pain was, and he said we could do this and get rid of the pain and go back and correct rest later. And that's what I wanted. I just wanted to get away from the pain. I want that pain to go away. There wasn't so much pain. So I chose the smaller. I said, just let's get it done. And I had to travel here, like I say, so.
We decided to do a smaller surgery, even though this bigger surgery was definitely an option. And could you explain to me after the surgery, first of all, where did we do the surgery? And after the surgery, about your symptoms and how you were doing immediately after the surgery?
There's the walkers and cane to get around. Even with the medication, the pain, if you weren't right on time with the medication, like I think it was 4 or 6 hours I was taking it, if I wasn't right on time and it started to lapse a little bit, I was getting pain. And then after the surgery, well, all I can say is 5 weeks I wasn't taking anything. No, nothing.
I remember as well that the surgery was 2 years ago, and now we have been following you up with this imaging, and you still have the scoliosis. And tell me about your pain level from 0 to 10 now, and things you can do and not you cannot do. And just I would like you to be realistic about your limitation and your symptoms now.
I
Okay.
do my exercises, the ones I did after I had my first surgery, and I try to do them faithfully every day, but I'll be honest, I slip once in a while. But I try to do them every day, and I've been getting by and going around, so I do things at home, but I just gotta watch what I do and how I do them. And I know, I'm learning what I can and can't do as I go along here, you know. Weight's a big thing. I don't lift a lot of weight. And like any kind of like shoveling or something, or chainsaws, one of the things that vibration, I don't mess with that, you know. Things like that where it's gonna vibrate. I do mow grass with a rider, of course, and I did go to till the garden this spring with no problems and stuff. Just watch what I do. If I got sore, I wouldn't have did it no more, you know.
Could you please tell me at this point what our options are as I described to you?
But unless the pain, I'm not in pain right now sitting here. Had no aspirin, nothing today, or nothing like that. I'm not in any pain. If I go and do something, like yesterday after a long drive, I was in pain. I popped an aspirin last night. And if I go home and I'm doing something, I don't get pain right away. It comes like a day or two later, and I'll think, oh, back, oh yeah, I did that, you know, and I'll pop a pill for the pain at the time, and then I'll try not to do that again. But as long as I can hold up to that, where I'm not in any pain walking or anything, there's no kind of, so I just,
So then,
Well, yes, our options are doing a bigger surgery or do a limited surgery in the area of T12 to L3, but honestly, I think that with your pain level of 0 to 4, I don't believe it's a good time right now to consider the surgery. Obviously, that's an option, but I think the best option at this point is just trying to keep your back strong. And if the symptoms are not improving, then we should talk about the surgery. Usually, these kind of surgeries are offered for pain level 7 and above. And I think as long as your pain is 0 to 4, we should just continue with the conservative therapy. So overall, would you like to tell us a little about your experience in the TBSI and the options you received? And overall, if you just would tell us what you think about the service you have so far experienced with us.
explains things that I never even knew on it. He'll show me, take the time and show me pictures and point out the x-rays on the x-rays, just what he's talking about and what it should look like and what it looks like. And yeah, he's very explanatory.
all right.
Just tried recommending him to somebody in the waiting room about the surgery. Yeah, I would recommend him to anybody that has back problems. See him. He's a good man. Who cares? Knows what he's doing.